Hi, my name's Courtney De Stefano. I'm a regional manager for Miami-Dade County Parks and Recreation. I would describe myself as someone that is optimistic, outgoing. I love to travel. I love to spend time with my family and my friends, going to the beach, trying different restaurants, just enjoying life. Before this diagnosis, I was fine. So this really took me by surprise. It wasn't something that someone my age was expecting. So the first symptoms I noticed was actually vaginal discharge. So I went to my gyno and they initially thought it was an infection. So they gave me antibiotics for 2 weeks and said, we'll see you when you're done with the dose. And then when I went back, they took a look and they said, okay, I'm gonna refer you to an oncologist. And that just kind of threw me off, those words.
So vaginal cancer is a very uncommon cancer. There are only about 3,000 to 4,000 cases a year in the entire United States. And it usually presents in older patients. So in Courtney's case, this was really an unexpected diagnosis.
2 weeks later, I was walking into Miami Cancer Institute to meet with Dr. Diaz. He said, we're gonna take a look. He was very professional. And then he came back in and he said, okay, we're gonna do surgery. I said, okay, yeah, we want to remove this, see what it is, and we'll go from there. But first step is definitely surgery.
She had a palpable mass there, and so the first surgery was to excise it and just establish the diagnosis, and then based on that would determine what further treatment she may require.
And then I came in on a Monday, and that's when he sat me down and he said, you have vaginal adenocarcinoma. And I said, what is that?
So the challenge with Courtney and vaginal cancer is the usual treatment for vaginal cancer, anything beyond a very early stage lesion, is pelvic radiation therapy. If we proceeded with the traditional radiation therapy, that would almost certainly result in her sterilization.
Because it was a vaginal cancer diagnosis, his first thought was fertility preservation. What can we do first to make sure we have everything saved and preserved, and then how are we gonna treat this?
We all felt that, yes, in fact, uterine transposition would be the ideal situation for Courtney so that we could preserve her future fertility and we could appropriately treat her vaginal cancer. She was very excited that we had gone through the effort of discussing this with so many physicians literally around the world to give her the best tailored approach.
I'm a yes girl. If you give me a chance, I'm gonna take it. I've been given the opportunity, why am I gonna say no? Let's try it.
Thanks to our collaboration with Sloan Kettering and our personal relationships, I reached out to one of my friends and mentor at Sloan Kettering who has performed the most number of these procedures in the United States, Dr. Marla Teo. So I traveled to New York with Courtney. The procedures performed robotically with small incisions. We begin by first releasing the uterus from the vagina. We then mobilize the uterus up out of the pelvis and into the abdomen with care taken to make sure that we maintain the vasculature of the ovaries, which now really becomes the primary blood supply to the uterus. We then fix the uterus in the abdomen outside of the radiation field. Patients can go home that same day. They will then go on to begin their radiation therapy a few weeks after the procedure.
My treatment plan included 25 sessions of external radiation and then 5 sessions of chemo. And then once I was done with the external radiation, a week later I did internal radiation.
And once they complete their radiation therapy, we then take the patients back to the operating room, again through a robotic approach, release the uterus from the abdominal area where it was fixed, mobilize it back into the pelvis, and now connect it back to the vagina.
We did the surgery at South Miami, and Dr. Lateo came down, and him and Dr. Diaz did the surgery together, and you know, that was kind of the last piece of this puzzle.
Courtney did great during her treatment between her first surgery and her second surgery. Her recovery was much smoother being here around friends and family in her own living space.
The way I'm feeling today is almost back to normal. I feel good, I'm back to work, I'm back to working out. I couldn't have done this without Miami Cancer Institute and everyone that works here. During the worst time of my life, walking through these doors, every day someone made it better.
So here at Baptist Health South Florida, we were the first to perform this procedure. We have the latest technology, we have the latest robotic equipment, we have the support of a dedicated multidisciplinary team to ensure that we're not only giving the best care, we're giving innovative care.
My future right now is just to continue being healthy, travel, hopefully find a partner, have a child. I want to live my life to the fullest. I always have, but even more so now.